Hi guys, welcome back. In this video, we're going to be doing an advanced practice for sexual health and power, where we will be combining the benefits of a deep squat together with targeted pelvic floor contractions. Deep squat, for those of you that are not aware, there are significant benefits of holding a deep squat position, such as increased blood flow to the pelvic floor area, strengthening the pelvic floor, reducing tension in the lower back, increasing strength in the abdominal areas, amongst many others. So it's something I would encourage you to practice daily. As we will be staying in the deep squat for the duration of the exercise, which some of you may find challenging, if at any moment you feel tension or pain, simply come out of the squat, place yourself into a normal seated position, and continue with the pelvic floor contractions. Moving on to the pelvic floor. In this exercise, we will be working with two pelvic floor muscle groups. First, those at the front, which are the muscles we might use to stop the flow of urination, and those at the back to, for example, hold in gas. Let's find them now. Starting with the front or anterior, squeeze those muscles located at the perineum as if holding in urine. Hold, then relax. Now, find those at the back, which might be more difficult. Squeeze the anus as if holding in gas. Hold, then relax. By targeting both the anterior and the posterior pelvic floor together, we will be increasing the efficacy of the practice. As you probably know, training the pelvic floor has significant benefits for one's body, increasing erectile strength, reducing incontinence, reducing premature ejaculation, and can increase libido. To perform this exercise, we'll be starting by taking a nice, long, smooth, deep inhale through the nose, filling up the belly. And on the exhalation, we're going to start by contracting the anterior pelvic floor in the front. And then as we continue the exhalation, we're going to be squeezing the pelvic floor on the rear at the same time. So both muscle groups are contracted. To perform this exercise, we'll start by taking a nice, long, smooth, deep inhale through the nose, filling up the belly. And on the exhalation, we're going to start by contracting the forward pelvic floor. And then as we continue the exhalation, we're continuing to squeeze the pelvic floor at the rear at the same time. So both muscle groups are contracted. Hold, then gently inhale and relax. One more time. Nice long inhale through the nose. Exhaling, squeeze the pelvic floor in the front. Squeeze the pelvic floor in the back at the same time. Hold and relax. We're going to do this for 12 rounds. So if you need to stretch out a little bit, you can. Wiggle your legs, rocking gently from side to side. And like I said, if it's very painful, you can come into a seated position. To start, if you like, you can bring your hands together in a prayer posture. Close your eyes, focus on my instructions and the contractions. So let's start. Deeply inhale through the nose, filling up the belly. And exhale, squeeze the front, squeeze the back, hold, and relax. Inhale. Exhale, squeeze the front, squeeze the back, hold, relax. Inhale. Exhale, squeeze the front and squeeze the back, hold, relax, and inhale. Exhale, squeeze the front, squeeze the back, hold, relax, and inhale. And exhaling, squeeze the front, squeeze the back, hold, relax. Inhale. And exhaling, squeeze the front, squeeze the back, hold, relax. 5 more. Inhale. And exhale, squeeze the front and squeeze the back, both together. Hold and relax. Inhale. And exhale, squeeze the front, squeeze the back. Hold and relax. Deep inhale. And exhale, squeeze the front, squeeze the back. Hold and relax. Deep inhale. And exhale, squeeze the front, squeeze the back. Hold and relax. Last one. Inhale. And exhale, squeeze the front, squeeze the back. Hold and relax. At this point, if you like, you can come into a seated posture. Keep your eyes closed. Just taking a minute with the eyes closed just to bring some awareness into your body, any changes you might be feeling. Simply observe, gently opening your eyes, coming back. This is a powerful exercise. Whether you're dealing with some of the challenges we discussed earlier, or simply want to cultivate greater power and awareness in your sexual center, I encourage you to practice this daily. For those in greater need, increase to 3 times per day, morning, noon, and evening, over at least 2 weeks to see real results. As always, consult a healthcare professional for severe symptoms. Thank you for your time, and see you again soon.